BC is finally starting to make COVID-19 rapid tests available to everyone.
Kits will start being available for pickup at select pharmacies as early as Friday, and it is expected that the number of locations will grow rapidly with time and supply.
Keyword is start, because initially there's a catch. Like vaccinations, the kits will go to those most at risk first.
We're going to use the same approach we've taken throughout the pandemic and focus in on those who are most at risk to severe outcomes from COVID-19. And that means, in particular, those over 70. So that's where we're going to start.
Those over 70 and those most at risk. 1 5-test kit per person per month, tracked with your personal health number. But for those eligible to get tests this week, do not just show up at your local pharmacy if you're sick.
If you're symptomatic and you're in any of the high-risk groups, or you need to have a test because of your symptoms, you can go to the symptom screener, get a PCR test.
For everyone else in the younger age groups, the tests should be available at pharmacies around the province over the next 3 to 4 weeks.
Really, the thing that will decide how quickly we move through age groups, it will be how quickly we get rapid tests in.
The expectation, he says, is 12 million tests arriving each week for the next month. Of the 14 million tests sent out around BC so far,
the largest number so far have gone to education, to long-term care, to healthcare workers, and to COVID testing sites, but they've also gone to rural, remote, and Indigenous communities, to childcare facilities.
Overall, the goal of broad rapid test distribution is to have people able to manage their risk at home, especially heading into the fall when cold, flu, and COVID season return again.
You can make those decisions about whether you're going to go visit an elderly person or whether you need to stay away from your grandparents for a couple of days.
Well, looking forward at what Dr. Henry calls the sustainable COVID-19 management strategy, basically learning to live with COVID, she is clear the virus is still a risk to everyone, not just the elderly, especially those who are not vaccinated.
However, in the last few days, we've had 4 people in their 40s who've died from COVID-19. That's important. It reminds us that everybody has risk.
In Victoria, Lisa Yuzda, City News.